Hello, Africa. You're welcome to ETV Ghana's African Women's Voices show. This is the show that tackles issues pertaining to women as they contribute to national development. How have you been? I am so excited to meet you tonight, and we are going to have a pleasant conversation. I know a lot of you have been, trying to understand why you feel that particular back pain you feel all the time. Today, we've got our doctor in the house from Focus Hospital. She will be delving into the issues around our spine, and then you will further the conversations at her hospital, okay? Or even on our Facebook, or you call us when it's time for us to have an interaction with you. But before we delve into that conversation, I'd like to let you know that African Legends Night was actually launched a week today, and this is what we experienced over there. Do watch this. The African Legends Night is a high-profile concert which recognizes and celebrates African musicians who are considered living legends. In marking the 10th anniversary, the concert will for the first time be hosted in December, offering a new December in Ghana event experience for Ghanaians and the diaspora. It's all going to be a full Ghanaian lineup as Amachi Dede, Rex Omar, Samini and Efia have been announced as headliners for the 10th anniversary concert of the African Legends Night. Efia, who is representing the feminine side, is a vibrant soul who joined the music scene in 2008. She describes her sound as Afro soul with a hint of pop. Her sound fluctuates depending on how she feels and who she's working with. Her compositions and voice have led her to win several coveted music awards in Ghana and beyond. She is the only singer to win Best Female Vocal Performance Awards at the Ghana Music Awards in 4 successions. The African Legends Night is powered by Global Media Alliance. African Legends Night, celebrating music of African origin. And you're welcome back to ETV Ghana's African Women's Voices show. Just before I took you over to African Legends Night information, I mentioned that we have our doctor in the house. And before I introduce her, I'd like you to take a listen to her profile. We couldn't capture everything, but just the little you get to hear will make you understand the authority she's got in this conversation. Do watch this.
Dr. Wolf is a product of Achimota School and the University of Ghana Medical School. She is also a fellow of the West African College of Surgeons. She worked in the Department of Anesthesia of the Kolebu Teaching Hospital for 18 years. During these years, she was one of the most vibrant and dynamic consultants in the hospital and participated in many high-level and risky surgeries, including renal transplants, liver resections, adrenalectomies, and brachytherapy for cancer of the prostate. At Kolebu, she was in charge of anesthesia for neurosurgery and played a key role in the management of complex adult and pediatric neurosurgical cases, including complex spine surgeries and craniotomies. Dr. Wolf was actively involved in the care of patients in the intensive care unit ICU and was the in-charge physician of the ICU for a 2-year period. As a member of the ICU committee, she prepared and supervised the implementation of protocols for patient management and critical anesthetic incidents. Dr. Wolf became involved in the Focus surgical program at the Kolebu Teaching Hospital 2008 and was in charge of organizing anesthesia for surgeries. Currently, she is the CEO of Focus Hospital and spearheading the attainment of JCI accreditation in 2023. Her goal is to be a role model for women in leadership and to always make a difference. Dr. Irene Adoko Wolf.
Wow, wow, wow. Dr. Wolf, I'm putting my hands together. I'm putting it together. You deserve all the accolades. You're welcome to ETV Ghana's African Women's Voices show.
Thank you very much. It's indeed a privilege to be here.
Oh. So you know what? Get closer to your TV set, your laptop or your phone and write whatever it is she's going to be giving out today in the way of information, because I'm sure you need this. So we are talking spine health in women. A lot of times you hear women complaining about upper back, lower back pain, middle back pain. Every side of their back always hurts them. We want to understand why some of these things happen to us. And if early detection can also save our life, as they always say when it comes to breast cancer. We just rounded up the awareness around it. The early detection could save your life. In this case, we're going to find out from the doctor if early detection can save certain things that happen to you in your spine. So what can early detection do if you get to have yourself checked in terms of your spine?
Well, early detection can save you a lot of pain.
Okay.
And then it can prevent your, whatever the cause is, from progressing to the stage where you feel numbness in your limbs, weakness, and then eventual paralysis. To be productive in life, to have a good quality of life, you must be able to move. So if something is going to start slowly and end up in your being immobile or end up in immobility, then early detection will indeed save your life. If you don't move, then the quality of your life is not the best.
It's going to be the best.
Yes.
Great. So you need to have that checked. And once you begin to feel pain, you need to rush to the clinic for them to check you and check you and check you again, so that you stop whatever it is that is causing it, or they help you straighten out whatever is causing the issue. So let's get to the nitty-gritty. Where exactly do we have the spine located in the body?
So the spine is right in the center of your body, and you find it between the base of your head, and then it goes right down to where you sit. Okay, so if you can feel your back, you can feel the bones of your spine,
Yeah.
and it goes right down. You're actually sitting on the lower part of it. It is the central support structure of your body. It is what holds your body together. It enables you to sit. It enables you to stand. It enables you to twist. It enables you to bend forward, bend backwards, and then to the side. It is what supports you.
Okay. Yes. Talking about twisting and bending forward and backward, traditionally we find ourselves all the time, maybe when we drop something and we want to pick something up. How exactly are we supposed to bend to pick that up? Because now that you're saying that depending on how we move and how we do things, our spine could be affected. How best should one actually pick up something from the floor?
So posture is one of the greatest causes of spine issues. To pick something up from the floor, you're supposed to bend your knee and then pick it up. Instead of bending your back, bending your back to pick it up. You're supposed to bend your knee. That will bring you down. Then you lift it, and then you straighten your knee, and you come up. And it shouldn't be too heavy.
It shouldn't be too heavy.
Yes.
You see, for those of you who are always criticizing women who would bend their knees to pick something up, hey, Ira, what is going on? You see, we are very good at doing such things. But from what Dr. Wolf is saying right now, that's actually the right way to pick up stuff. You need to bend the knee and pick it up, and not bend over to pick them up. I hope you're picking up these things and you will be putting them into practice. We have an understanding of where the spine is located and how we should pick up stuff from the floor. Now we'll go for a quick commercial break. When we return, we get to find out what actually causes spinal injuries. Do not go away. And you're welcome back to ETV Ghana's African Women's Voices show. Before we went on the break, I said I was going to be asking Dr. Wolf exactly what it is that causes spinal issues for us all as women. Well, men, you can also take some tip, because you need to give your wives, your sisters, and the feminine side some information that you gain tonight. But before I go to asking her what are the causes, there's this question that has been on my mind to ask you. And it has to do with, sometimes when you feel that tension, or, you feel there's something around your back, and then you give a stretch, and then you hear the cracks, and it feels really good. What does it really mean? Does it mean you're aligning your spine or the bone?
Not necessarily.
Okay.
It has to do with lying in or sitting in one position for a long time, and so the muscles are stiff. And so when you actually give it a very good stretch, then you just relax them nicely. And especially when you do it early in the morning, when you wake up, it is a very, very good feeling. And that relaxes you. And then you get up out of bed and you just move on. And feel better doing your morning chores.
Okay,
yes.
So it doesn't really hurt anything in your spine when you do those stretches and you hear those cracks?
No, it doesn't.
Okay.
It doesn't.
All right, that's good to know. So we're moving over to the question I wanted to ask again as to what are the causes of spinal issues? What caused them?
Okay, to understand the causes of a spinal injury, you need to know a little bit about the structure of the spine, nothing in detail. The spine is made up of about 33 bones, and they are stacked one on top of the other.
The other.
Yes. And now if they are stuck together, there must be something holding them. So between two vertebrae, or the bones are called the vertebrae. Between
Okay.
two vertebrae, you have the intervertebral disc. Okay, so that one is there between the two. It's a fibrocartilage. Okay, the outside is firm, not too hard, but it's firm, and then inside it is gel. So that takes all the shocks that the spine has to take the whole day. It helps it to do that.
Okay.
And then also the individual bones at the back of the body is they are joined together with a little joints, a lot of them. Okay, and at each joint you have some cartilage inside there, then you have muscles around it. Now all this is important because your spinal cord runs in the middle of these bones. There's a spinal canal in there where your spinal cord runs through. So they all form this bony structure to protect it. Now if you have a highway, okay, with cars running down, up and down the highway, and then you see that as you go you have exits so that you can come off the highway. The same way the spinal cord is coming from the brain down to the middle of the spine, and it has nerves that supply all your body. So as it comes from the brain, it gives off branches to your arms, gives off branches to your chest, gives off branches to your abdomen, and some branches go into your legs. Okay,
Wow.
so there are holes in this bony structure where all these nerves pass. Okay, so now if you have, maybe you are exercising and you twist too much, okay, you cause some sprain in the joints or at the joints or in the ligaments that are joining this bony structure. So this kind of exercise, or sudden twist, or maybe you're picking something up and the ligaments complain, no, it's too much.
Too much.
So that can cause you pain. Sometimes the intervertebral disc, in women especially, nemesis are hormones.
Okay.
During pregnancy, your estrogen levels drop, progesterone takes over to take you through the pregnancy, but progesterone has issues. During menopause, estrogen goes down, progesterone goes up, and then you have issues. So those two sets of women have a lot of problems with the spine, especially in the elderly women. Your bones, the progesterone makes your bones so thin. The rate of bone loss is more than new bone formation, and so your bone is porous, and that makes it very easy for you to have back pain. That makes it interferes with the structure of the spine. I forgot to say the spine has certain beautiful curves. Okay, the nerve curves forward, the chest goes backwards, the abdomen comes forward, and the coccyx, the sacrum goes back. All these things, it's important that the spine maintains these natural curves. If you disturb the curves, you disturb the cord passing through the spinal canal, and you disturb the nerves coming out. So when you do something and your discs rupture or they protrude backwards, they press on these nerves that are coming out of the spinal cord, and you have pain. But that is the kind of pain that will probably not stay in your back, but go all the way down.
Okay.
Sometimes with wear and tear, you develop what we call osteophytes or bone spares on the bones in your, there are these spicules, actually with sharp tips, and then they impinge on these nerves that are coming. So if they say you have osteoarthritis, it is that kind of thing that is happening in your spine, and they also cause a lot of pain in your back. Okay. And then you can have things like infection. TB is a big one in our environment, and now you have the drug-resistant one. It also worries your spine. Some people develop tumors tumors of the spine. We had a pregnant woman who was very fine. One day, suddenly, she can't walk. She had a tumor in her spine. But, I mean, thankfully, we were able to take it out, and she still maintained her pregnancy, and she came to visit us with her baby. And she was walking. She came in a wheelchair, and she was walking.
And she walked?
Yes, she walked and came to visit us holding her baby in her arms. It feels very good to be part of something like that. So you can have all these things, but the commonest is the wear and tear. Yes, the wear and tear that worries the spine. And then the elderly people, the osteoporosis is a problem.
Okay.
Yes, it can even let the vertebrae fracture spontaneously on their own or with the least force. They just fracture. You get a compression fracture and it's very painful.
Very painful.
Yes.
Okay, so now we know and understand that wear and tear is also part of what causes, spinal injury, and the fact that estrogen levels are going either high or low. They all have contributing factors. They contribute to it. So how would somebody actually know that they've got a spinal injury? Aside the pain, or is it only the pain that will let you know that you've gotten a spinal injury?
Usually, it may start with pain, or then again, it may not. Sometimes, too, you just feel the pain may be, if it's there, it may be localized to your back for a while, and then sometimes it may shoot down into your legs. At other times, you may not feel any pain, but you just feel some numbness in your one extremity or the other, or a tingling sensation like pins and needles in some part of your body. And then in the severe cases, you may have impaired bowel and bladder function. You can't control the way you pee, yes, or move your bowel. Those are extreme cases. So when you
So a spinal injury can
yes,
actually cause something like that?
Yes. Loss of bowel and bladder control, yes. And then you feel a heaviness in the limbs, and then that happens before suddenly you can't move.
Okay.
Yes, they get very heavy. Lifting them is a problem. And after a while, you can't lift them at all. So if you come when you start feeling the pain or the numbness or the tingling, and let's find out what the problem is and see whether we can solve it, then it won't progress to the heaviness and the weakness and the paralysis.
Okay. All right. So now, because we are focusing our attention on, spinal health in terms of women or in relation to women, we have several types of back pains that women experience. Could you take us through some of these types of back pain so that whoever is watching right now, from your description, at least will have an idea that, okay, it could be here or there, and then seek professional help?
Well, the back is all the way from the back of the neck to, like I said, it goes, you're sitting on it. So if the pain is in your neck, if the problem is in your neck, typically you might feel the symptoms in your arms. Okay, so the numbness will be in your arms, or sometimes you even fall unnecessarily. You don't know why you fell. So the numbness, sometimes you realize that when you shake somebody's hand, you can't hold the hand. Your grip is not so
firm.
strong. Yes, you realize you can't zip your dress or, do your buttons. You drop everything that you are holding, and you don't understand. Yes. And then sometimes you get change in bowel habits. You have normal bowel habits. All of a sudden, you're always constipated.
Okay.
Okay. Or you feel your belly feeling a little full.
Okay. Like you're bloating.
Yes, you're bloating, sort of. And then also sometimes the same thing happens in your legs. You may suddenly have a shooting pain going down there without any pain in your back at all. Okay, and then you have the same tingling in your feet, and maybe in your feet or whichever part, whichever nerve is being pressed on, and then like I said, you begin to feel the heaviness and then the weakness, and then the worst case scenario is your bowel and bladder function. Yeah.
Okay.
So if you have any of these things, then it's good to seek help.
Okay, so now let's look at posture. So if people sit, how should we actually sit? Are we sitting right? Because I'm sure posture contributes a lot to spinal injury or the way our spine will end up shaping itself, because you mentioned that the spine is in a certain way, but you find out sometimes some people, after some time or some years, as if it's beginning to shift, or bend in certain ways, and you're wondering, is it a nutritional defect, or is it because of the way they are not really, making good use of their sitting or standing or lying posture?
It's actually not just sitting, but sitting is is a big culprit, because even if you sit right, like I said, you have to know the normal curves. So your abdomen is supposed to come forward. So you will sit straight and put a bit of a cushion in your back. Some chairs are molded that way, and so you can do that, but you can put a bit of a cushion in your back, and then you don't stoop, you don't bend over, hunch. But it's very difficult because now most of us are working on our computers.
Yeah, so we're always like this,
at work, so you're always
slouchy.
like that. And then the worst thing is that we can sit for 3, 4, 5 hours without getting up. You need to get up.
Okay.
Every hour, get up and walk somewhere. Go and harass somebody in the office.
Just move.
Or move, yes. Climb up and down the stairs and come back and sit down. Because even if you maintain the right posture, the muscles are held in that, same position for a long time. They need to relax a little. So you sit down for an hour and then find something to do that will take you out of your office, and then you come back. But especially for us women, we are at home doing chores. You are turning this way, you are turning that way. You are picking up after the children. You are washing up. You are standing for a long time. You are doing all of that. And then when we finish, we go to work. And then we go and sit. So if you come to our outpatients, there are more women with the back pain than the men. Yes, yes.
Wow. At this point in time, I'm sure you've got questions that you would like to ask. Please do send them to our Facebook page at ETV Ghana. I'll be asking the doctor all of it. Do stay tuned as we go to this commercial break. You're welcome back to ETV Ghana's African Women's Voices show. Before we went to the break, I said that our Facebook page is available for you to drop in your comments and your questions. And I am so happy that some of you have already started dropping your questions. And I'm going to be asking Dr. Wolf those questions right away. So please draw closer. I may be asking your question any moment from now. And this question is coming from Nayele in Tama. She says, what can I do to improve the likelihood of surgical success? What can I do to improve the likelihood of surgical success?
That is a good question, and I'm glad you asked it so that our patients will all listen and help themselves. Usually, when you see the doctor, they tell you a lot of things. They actually explain what is going on to you, and then they tell you the things that will aggravate your situation and the things that will make it better. You see the nutritionist, they tell you what you should eat. You see the rehab, the physiotherapy team, and they give you exercises to do. Now, these are not very easy things to do, but if you keep your mind on what the final outcome that you want, successful surgery. Yes. And so then you do what the surgeon tells you to do. If they said do not run, I had a disc rupture, and I was told do not run. And I loved to run. I could run 3 kilometers. So I asked, okay, so can I walk? And he says, yes, you can walk. And so I decided to walk instead of run. So it gave me up to a year not to run. That was difficult. But even now, I don't run like I used to. I will just jog slowly, So you do what the surgeon wants you to do. You eat as the dietitian asks you to do. There are things that, like all these olive oil stuff, all these oatmeal stuff, and things that improve anti-inflammatory diets, they call them. They all help you. And then with the rehab, the physiotherapist gives you exercises to do. Now, those exercises are not easy to do, especially when you are in pain. But you see, when you are in pain, you are told to rest. And while you are resting, the muscles and the ligaments around the spine that actually hold it in place are also resting. And they are getting weaker. As they rest, if you don't use a muscle, it gets weak. They are also resting. So now when you have to do the rehabilitation, they complain bitterly that you are taking them from their resting position
place,
and want them to work hard, and it causes a bit of pain during your rehabilitation. But if you just keep your eye on what you want your final outcome to be, and then you brace yourself and go through the rehabilitation, I think you do very well.
A lot better.
So just listen to all the instructions they give you. They are based on very, sound reasoning.
Okay.
Then you'll be fine.
All right, so I have another question. This question is coming from Mausi. Mausi is in Sunyani. She said, what can I do to shorten my hospital stay after surgery?
Once the surgery has gone well, you'll be in some pain. So usually we give you some pain medications to help you. Now, like I said, the next thing, and for me, the most important part of spine surgery is the rehabilitation.
Okay.
That part is the one that you have to do very seriously. And imagine you have finished this back surgery, and then the next day the physiotherapist comes and says, okay, you have to get out of bed today. I mean, the first thing is fear and panic.
Yes.
But they are very good. They help you. And with the time, your pain medications, so at least a focus we do, so that they are at their maximum, they are operating at maximum when you are doing your rehabilitation.
Okay.
Okay, so if you have rehab, they'll time your pain medication maybe an hour and a half before. So that while you are doing the rehab, you have some pain medication on board. And then you get up and you follow their instruction. The rehabilitation is very important. And we have targets that you have to meet. When you're going home, we don't want you to go home and be dependent on
the people
anybody
around you.
I mean, not too much, okay? So we have to make sure that you can get up from your bed and walk to the bathroom and back. You can sit up, get out of bed, sit in a chair to eat. You can maybe walk outside to get some fresh air. Once you are able to achieve these things, we discharge you from the hospital.
Okay.
Straight away. We don't even wait for your wound to heal.
Completely
because
heal.
you can come to the hospital for wound inspection every day. But you must be have some independence.
Okay.
Yes. Otherwise, you just go home and lie in bed. And you know, lying in bed comes with complications. And even your wound will not heal properly if you just do that. So before we discharge you, you have to meet those targets, and then you go home.
Okay, another question here is from Blessed. Blessed is in Axim. He says, will I still have pain after surgery?
Blessed. Unfortunately, we don't do magic so that as soon as we finish the surgery, the pain has gone
away.
But as I said, we give you pain medications, and really, usually, the pain that you feel is much better than what you came with. Okay? Remember that these nerves have been, there's something pressing on them for quite a while. So they are swollen, they are angry, and you have to give it time to settle. And we actually give you medications for those ones as well. So it will take time. Yes, it will be definitely better than it was before surgery, but it will not completely disappear immediately after the surgery. With that, and then with the rehabilitation, that will get your muscles back in shape. Then the pain gets remarkably better. A lot of people don't have any pain at all after about 6 weeks of surgery.
Great. I'm going to take the last question, which is from, this is from Abuja, and the person's name is Yahya. Yahya, you could be a male or female because the picture I see is a flower, so I can't really tell, so I don't know. So Yahya, I'm asking you a question from Abuja. Will I need another back surgery in the future?
It is, I wish I could say a definite no. but I can't. Because depending on why you needed the surgery the first time, you may or may not need another one.
Okay.
And one, there may be some complication with the first one. Sometimes you fix the spine and then the area on top of it just decides to buckle. It's a known complication. So you might have to come for us to fix that part as well. Sometimes too, if it is wear and tear, the wear and tear that caused the first surgery can happen at another part of the spine, and so you will need surgery for that one as well.
Okay.
But usually, if you follow the instructions you are given, if you're asked to wear a brace, you wear it. If you're asked not to do certain activities, you don't do them. If you're asked to do things in a certain way, you do them. If you do that, the likelihood is a little less. But yes, complications may occur and you may come back. But that is more the exception than the rule.
Okay.
Yeah.
Well, somebody just dropped another question and it's eagerly interested in knowing, okay, how best one should sleep. So what's the best way to actually lie down? Some say on the floor, some say on a cushion. People have different theories. So if you can assist us to know, I mean, what is the best place to sleep?
You see, some people have been lying on the floor forever. You put them on a bed. We've had patients who lie on the floor. They've lain on the floor forever. You put them on a bed and they can't sleep. So they are comfortable on the floor. Some like very soft mattresses. So the best ones are the ones I forget the name, but there are some mattresses that actually mold to the contour of the spine.
Oh, the spine.
But you can lie on your back, small pillow under your head, and then under your knee you put another pillow. When you raise the knee a little bit, the spine is in its perfect contour. So you can sleep like that.
So it's not only about lying on your back. You need to
You
put
need
a pillow
under your knee, yes. Then it makes those natural, the beautiful curves I talked about.
Yes.
It puts them in their normal position. If you want to lie on the side, that's fine. One pillow, and then you put you put a pillow between your legs. At the knee, but between the legs.
Between the legs.
You see that it raises the leg up a bit, and then the spinal curvature is as it should be. And then you are fine.
But you know that
But
sometimes we roll and roll. How are we going to be able
yes.
to maintain this position?
It's
to have a pillow in
difficult.
between our legs to
It's
sleep?
difficult. You can only try.
Ah, okay. So maybe when
But
you wake up to pee and it's not there anymore, you have to just
You
put
just
it back
put it
there.
back there, yes.
And
yes.
over time, your body gets used to it, and before you know it, maybe you may not even be moving that much because you need to maintain that particular posture.
Yeah.
I hope you got that information. It's not only about lying on your back. When you lie on your back, you need to have a pillow behind, and then also have a pillow underneath
your knee.
Ah,
yes.
underneath.
But when
your
you
knee.
lie on the
side,
then it should go between the legs.
Well noted. I definitely will be trying that out tonight because I really want to have a very good sleep, and I'm so conscious of my spine now. Did you know that World Spinal Day is the 16th of October? Well, keep watching ETV Ghana's African Women's Voices show. We definitely hear from Focus Hospital almost every time in the year when it comes to
Yes,
talking about
you
our
will.
spine. You get to see her. If you don't see her anytime, once it's World Spinal Day, definitely you're going to be seeing her or whoever she's going to be sending from Focus Clinic to come and talk to us about the spine. I think that's good. Thank you so much.
You're
We
most
are making
welcome.
that request and we know it's working out. I'm just
You're
putting
talking
to her
to the
right now.
person, yes. So it will work out.
Okay, so because we're still concentrating on spinal health for women, what are these, would I say, maybe the kinds or the types of back injuries that are particular when it comes to women? Do we have any such things?
Oh, you can have falls.
Okay.
And falls happen especially in the elderly people. Okay, and you remember their bones are osteoporotic, as I said. So with the least trauma, the spine they get a fracture
okay.
in the spine, yes. And then for the athletes as well, and those who are very exuberant about their exercising. I remember my disc ruptured when I was exercising. I just bent down this way, I bent the other way, I went the third time, and then I heard a sound, and then I couldn't get back up. Yes, and so I had to lie on the floor for a while, and that's how it started.
Okay.
So when you're, these days, everybody is really exercising and wants to
be in shape.
keep fit. So you do that carefully. And then when you are sitting in the office, that is the biggest, another big one, let me say. And you are sitting down, be mindful of your posture. Remember that at home you are sweeping, you are cleaning. You can't be thinking about your posture while you are busy. You know, you get home at 8 p.m. You have to make sure the children are in bed. You have to clean the place. You have to do. You are not thinking about how you are bending and twisting and all of that. I understand the practicality of it, but just try to bear that in mind. But in the office, you can make a conscious effort to do those things. And then also, I forgot one thing, the deformity. Why did I forget deformity? Because that's what focus is known mostly for. For the girls who have the deformity of the spine, it's better to get it checked out earlier, so that the little girls, if you are little and you get your mother realizes the spine is crooked, all you may need is a brace to wear for a while, and it will stop the progression. It won't even need surgery. Okay, so you can do that. But if it comes too late, then you might have to correct it, because as you grow, the curvature gets worse and worse. The spine actually bends over itself, and your heart is and your lungs are there, so it just squeezes them. So you see that now after a while you are just tired all the time. You can't do any sport, you can't do anything. Yeah, so it's better to have it checked out early. The rest of the stuff is really both for men
and women.
Women. Just have your back checked early and reduce the wear and tear of the back. Yeah.
Great. I see some more comments pouring in. Naomi Kweku says, I'm learning a lot this evening.
Thank you.
Susan A.J. Asari says, are waist pains caused by defects in the spine?
Oh, not necessarily.
Okay.
There are muscles there are ligaments. It's not necessarily spine problem. If it persists, you have to have it checked out.
Have it checked.
Yes.
Great. And Susan comes back again and says, that's my mommy, my pride. I love you, mommy.
Oh, Susan.
Then we have Stella Dede Williams says, very educative and interesting. Wafa K says, I am watching. Blaze says, I just shared this post. I love it, and I want a lot more people to hear about how to take care of their spine. Thank you so much, Bless. And then I also see Ejari. Ejari says, thank you for the information. Now, before we wrap up, I'd like to take a look at the foundation side of Focus.
Okay.
Focus, I noticed when I went on your social media pages about all the beautiful things you do for people, helping them raise funds for, for their surgeries and all of that. Could you talk to us about what you do at the foundation?
Okay, so our passion really is orthopedic, spine deformity and orthopedic problems in children. Okay. Now, a lot of these children come from places where, if you are born with a deformity, you are, you are set aside. They don't send you to school, and even when you do go to school, they laugh at you so much. Eventually, you sit at home, so you never achieve your full potential in life. So what we do is, for those who cannot raise the money on their own, if you can raise it, you will pay for it. It's a lot of work that we put in there.
Okay.
Very high quality and very safe. To make it safe, we have to do so many things. But for those who can't, we actually go soliciting for funds. Yes, I've gone to so many people to try to help these people. And then once we fix it, and then they go back to school. Some have finished university. We have, I think, 2 of them working with us at Focus. Yes, yes.
Wow.
And then, yes, one finished tech, and she's teaching somewhere. She has done her master's.
That's beautiful.
Yes. So for those who cannot afford it, we actually go around and look for money from both here and outside, wherever we will get it. Yes.
So how can people donate? They go to the foundation's Facebook page to make
Yes,
the donation?
or just go to our website.
Okay.
There's a link for donation.
The donation.
Yes.
And the
yes.
website is?
And what we do is once we get the donations, we keep you updated on everything that we do for the particular patients that you are sponsoring.
Okay.
So when we finish everything and we discharge them, we send you a whole report on how everything went,
Worked
so
out.
that there is accountability. Yes. Then you
Okay.
don't feel as if maybe your money was used for something else apart from what you wanted
Okay,
it
so
for.
go to Focus Clinic, go to their website, and you get to see how to make a donation to help all these children who have been deformed in the area of their spine. Somehow, we just have to draw the curtain at this particular juncture. It has been an interesting time with Dr. Wolf. Thank you for honoring our invitation.
The pleasure was all mine.
Oh.
Thank you.
Okay, so please, until we meet next time, do enjoy the rest of our interesting lineup for you. Bye-bye.